Hi, my name is Carlos St. Just, licensed acupuncturist, holistic healthcare provider. I'm here to speak on the topic of traditional Chinese medicine and COVID-19 and some of the research that's being done in China, as well as the treatment being offered to the patients. And so, excuse me here, this is a brief introduction. We can go on for a very long time in terms of trying to look at the studies and look at the formulas and the data. And first off, I want to say that according to the CDC and according to the World Health Organization, there is no preventative uh, uh, cure for COVID-19 at the moment besides the vaccines that have been recently approved. Those are the only cures, preventative measures that have been approved by the FDA, the Pfizer vaccine and the Moderna vaccine that have been approved. Those are the only ones that are regulated and approved by the FDA to treat COVID. So none of the information that I'm sharing is a cure, or this is not intended to be medical advice for you in particular. It's more for our field of study and looking at the scientific data and seeing if this can be implemented. And I think there's a lot of different things that go into this. For instance, if you hear a formula, if you hear a herb or something like that, it's not, one of the worst things you can do is just hear something and then go out and rush out and get it. You have no idea how it's used. You don't know how it's used traditionally. You don't know how it's used, right, scientifically. So that is a no-no, right? So with that, if you have any ailments or any conditions, you can please go see your healthcare provider. In the state of California, licensed acupuncturists are considered primary care providers, right, in the sense. So if you have an issue, we can treat you or we can refer you out to the appropriate department, appropriate modality, either whether it's through emergency care or whatever the case may be. So with that, I have a couple of notes here, and I will be using my computer as well. And these are just studies. I'm going back, and I've had a chance to look at the studies from March until the end of the year of 2020. To date this video, today is January 5th, 2021. So the date of the video earlier. However, I want to look at this study first. It's called An Association Between Early Treatment with Qingfei Baidu Tong, Qingfei Baidu Decoction, and Favorable Clinical Outcomes in Patients with COVID-19, a retrospective multi-center cohort study. And in this study, they took patients from over 54 hospitals and looked at the treatment. Let me see, 54 hospitals were enrolled from January 21st, 2020 to March 10th, 2020. And I'll go into the reasons why we need more research or we need more testing, because this wasn't a double-blind randomized control study. It was a multi-center cohort study with 943 patients. From the data collected, and I'm going to jump here, so you can see in this, actually, all this information I've obtained from PubMed. Right? Additionally, antiviral drugs, antibiotics, corticosteroids, and symptomatic treatments were used for patients. Okay, and what was the outcome of the study? Present study show that compared with the treatment initiated 3 weeks after onset, treatment initiated within 2 to 3 weeks, 1 to 2 weeks, or less than 1 week, had 2 to 3 times more likelihood of quicker recovery. We found that early treatment of Qingfei Baidu decoction is linked with favorable clinical outcomes of quicker recovery, a shorter period of viral shedding, and a shorter course of the disease, and a shorter duration of hospital stay. Right? Very awesome. Very awesome. And so they also break down the time period, right, from 1 week, before less than a week, to 2 to 3 to 4 weeks. And this is an important study to me because a lot of the information that was initially coming out was either a review or a perspective. There wasn't any solid data. And so now we have some solid data to say, hey, let's look at this formula and see if it's something that's beneficial. Right? I want to go to another study here. Right? And this was in the journal, fast cash, of Pharmaceutica, Acta Pharmaceutica Seneca. This study is called Combating COVID-19 with Integrated Traditional Chinese and Western Medicine in China. And this was actually submitted on April 22nd of 2020 and revised and received in the revised form and accepted on June 8th of 2020. And just some things to point out here. And one thing, and I'll point this out for all the studies, which we need, I think, in order to improve the validity and really implement it to a gold standard here in the United States. And that's one, all the trials lack the blind aspect to it, component, right? The blinding information and the randomization, right? And overall, more double-blinded randomized control studies are needed. For acupuncture, it is a little bit different. It's a little bit more difficult to implement a study like that. But for herbs, it's a lot easier. And so, that's why I'm all for the vaccine, because you look at how many participants they acquired for the Pfizer vaccine. 44,000 participants. Right? That's a lot of people. Right? So if we have that many people to try out herbs that have very minimal side effects, we can get a lot of research done. So with this study, it was actually a systematic review. They looked at 16 published papers on the topic, and they were able to a systematic review of 8 clinical trials. And the data suggests that integrative medicine can help reduce cough and fever, help reduce the incidence of severe or critical events, and improve clinical recovery. Okay? Another study with 308 cases suggested that after receiving traditional Chinese medicine treatment, all mild and moderate COVID-19 cases recovered and did not progress to the severe or critical stage. Right? So, looking at this data, we want to look at 2 things. There's this argument that an approach that traditional Chinese medicine as a whole can be beneficial. We know traditional Chinese medicine, it's not just acupuncture. It's the acupuncture, it's the herbs, it's the exercise, the breathing exercise, it's the theory. And as an acupuncturist, we have our scope of practice, things that we can do under the legal medical scope that we are licensed to do. So with that, here in the United States, we're going to be isolating. We want to find the isolated compound, the isolated component, or the mechanism. can even say the mechanism and really understand and break something down. So this, the argument of just using traditional Chinese medicine, it needs to be broken down, which we do. Right? Yeah, the formulas and understanding what the formulas are, and now we have what is it, network pharmacology, where you can look at the compounds and use computer any kind of computer database or computer analyzing software to see what compounds can interact and what proteins can interact with the virus. And it's very unique. It's very awesome. I think it's great. Another study here, another paper I want to bring up, and it'd be easier if I did this here. You always think of the ideas later. And this is on a formula called Lian Hua Qing Wen. And I have the DOI number here, which I will post, and you can find access to the study here. And it's called Traditional Chinese Medicine, Lian Hua Qing Wen, Treating Coronavirus Disease 2019, a meta-analysis of randomized controlled trials. Once again, I'll tell you, I've been on Facebook for 9 years, and I have not gotten flagged yet for any kind of misinformation, because you can find this information on PubMed. You can find this information in scientific journals. And I feel as we learn more about the disease, we're going to discover more natural herbal treatments that can help to eliminate and prevent, or eliminate or prevent or improve the recovery rate, not only for this illness, but potentially other illnesses that will come back, right? I don't want to say maybe or maybe not, because history has shown that, you know, we're not, as human beings, we're not, as a planet, we're not void of disease and illnesses that can spread. So they looked at 2 trials, including 145 patients. The sample size varied from 20 to 50. The study showed that the disappearance rate of the symptoms, right, was from the formula was significantly higher than that of the control group. The disappearance rate of the secondary clinical symptoms was significantly lower. Right? The duration of the fever was shorter than the control group. I'll say that again. The duration of the fever was shorter than the control group. And as I was pointing out earlier, one of the things we want to look at and try to improve on, you know, I say we look at testing and we try to make it better, right? Because we're trying to make things better for everyone. We say thank you for getting the ball rolling, and then we take it, right, and we go further. All the trials lacked blinding information and no reporting of randomization procedures, right? And once again, this goes back to more rigorous studies can be done here. I don't know why they're not done here in the United States. How come we don't take this information and run with it? And I wanted to make this video because I've seen a lot of the information. I've seen the information about the masks and the data, and it just seems like we skip over the traditional Chinese medicine. It doesn't garner a lot of media attention, and I believe it needs it, because it's a beneficial system. It's a way of learning about others' culture. It's a way of learning about people. It's a way about learning of a system of medicine we can integrate, make better, right? We can do everything. We can combine it. And that's the other thing, is that in China, it seems like it's easier, right, for these different systems of medicine to either work together or be able to build to be able to utilize their resources in order to do what they need to do, and then share the information. For instance, there's hospitals that are dedicated to just traditional Chinese medicine in China, right? And it's not because they already know that there's lots of the medicine. The medicine works. It's effective system of medicine. I don't get why when there's something that isn't working for the patient, we just don't say it's not working for the patient, right? We just kind of throw the baby out with the bathwater. I hate to use that analogy, but that's what we do. Just putting it all together, saying, okay, let's see what components can work for us, what the data shows, how is it used traditionally, how is it used clinically, and give more power to our providers here, our practitioners, right? And so it's more so building those centers. There's the acceptance, there's the knowledge that the patients are going to be taken well care of, and things can work. And then they have the biomed, and there's different aspects. If they need emergency care, that's available, right? And so just having those different components. From here, another study, and I have the DOI number here. 4 patients were recruited from January 1st to January 24th, 2020 at Shanghai Public Health Clinical Center in Shanghai, China. Okay, and all patients received antiviral treatment, including lopinavir and lopinavir and ritonavir, and arbidol, which is not a medication here used. I believe it's used in China and Russia predominantly, and ShuFeng Jie capsules. And ShuFeng Jie is another Chinese formula, traditional Chinese medicine formula. I think once the tensions calm down, once we're more reasonably thinking, we will find more answers, right? We will be able to talk and slow things down, right? Right. So with that, I wish you the best. And if you need any more information, I'm just seeing if there's anything else I left out. If you want any more information, you can visit csjacupuncture.com, and you can find me on social media. You can come by my clinic. I'm here in South Pasadena and Burbank. You can contact the clinic anytime. I am always available to answer any questions. You can always send an email at mailbox, or send an email to mailbox@csjacupuncture.com. Thank you. Stay safe, and looking forward to speaking again soon.